Sure. The adjustment itself. Let me first go back and talk about what are we trying to accomplish with the adjustment. There's three things in the animal world that we're trying to accomplish with the adjustment. The first thing is that we want to what we call free up what we call the fixated joint. That's the joint that might not be moving well. This part of the spine that might not be moving well. That's easy for everyone to understand. If this isn't moving well, then I want to try to make it move better. And that is the obvious one that we can all understand. There's two other things that happen with the chiropractic adjustment. One, the first one of those two is that when we're stimulating the spinal joint, it stimulates what's called mechanoreceptors. So here's our neurology 101 that we always talk about. Chiropractors always talk about. We stimulate mechanoreceptors, which send a signal to the brain to try to turn off pain and inflammation. So, and what's probably the coolest thing about this is that our stimulation to the joint and to the mechanoreceptor is faster than the pathway for pain and inflammation. So we're trying to almost speed by that and turn it off, or at least modulate it or slow it down, because we have this fast pathway. And then the final thing is when we adjust and stimulate along the spine, we stimulate the autonomic nervous system. And the autonomic nervous system is that part that as humans we know is we call it the... Can you sit down? Sit for me.
Should I sit?
Sit.
Sit down, hon.
Sit, sweetie.
No, I guess she's going to stand. Okay.
She's going to stand.
I got it.
What we as humans call the fight, flight, fright system, that like if you almost hit the deer and you feel all your heart rate increases, you feel all shaky. That part of the nervous system is also the part that, of course, it regulates our heart rate. It regulates our bowel, our bladder, and so we can actually have an effect potentially on those. If there's an issue with, for example, urinary issue because of arthritis in the spine.
So that's a benefit for any dog, those three things. Okay,
correct.
Gotcha.
Yeah, and so then how do we perform the adjustment? An adjustment is a force applied. So you can apply the force by hand or by mechanism, okay? And excuse me, if you apply a force, so if I have my hand and I'm extending back and I'm pushing down, I have a force, and then I have a mass that I'm applying, and then I have an acceleration. Force is mass time acceleration. So I have the mass of my hand, which is fairly heavy, and then I have the acceleration of my hand, the movement.
Now you do that on most dogs, that hand, or do you do
I don't. I use the instrument.
Okay,
we'll talk about that, but you can use your hand. Again, it's force equals mass times acceleration. So with my hand, I have a fair force, fair mass with relatively slow acceleration, because my muscles can only move so fast. The instrument has a very small mass.
Can you turn that so they can see that better?
Yeah,
there you go.
Very small mass. It's just a little tip, but it has a very, very quick acceleration.
Turn it the other way so it's facing. There you go.
Like that.
There, perfect. Perfect.
So it has very fast acceleration. So small mass, much more acceleration than I can have. So the force can actually be more.
Now, do you use the same type of an instrument used on a person?
Yes.
Okay.
Yeah, because it's the same thing.
All right, same idea. So this isn't just an instrument or a mechanism that's used on animals. You can use that on a person.
Can be used as a human instrument as well. It all comes down to that formula: force equals mass times acceleration. Mine may be larger mass, but not as big of an acceleration. Smaller mass, much more acceleration.
How much pressure does that? Is there a way of calculating how powerful that is?
There is. I don't know.
I wonder how big it is. I mean, I wonder how
powerful.
Well,
you can. It's spring loaded, so you can get. So when we're say doing manipulation on a horse or a cow, a 1,500-pound cow, I can add more mass.
Oh, okay.
Yeah, more mass to it, and I still have that acceleration. Whereas with with the dog, especially when we get Lily in here, a much smaller dog, you'll see that I'm using. But see, I can get more mass, but I still have that quickness of.
Now, how long does it? Well, you're going to start doing that now.
Yep.
How long does it take for the whole system to? I mean, how long does it take you to do this?
To do this, just a matter of minutes.
Okay.
Yeah, very quickly. So, so what we do with Honey Bun is, and what I do with most dogs, unless if I know there's only an issue with the back end, a lot of times we'll start here and go down.
Which is very common with older dogs.
Right, and if there's in her case, she's been adjusted many times, and I'm just trying to make sure she doesn't have any problems top to bottom. We go top to bottom.
Does this work? And I was saying the older dogs. Does this work for arthritis in dogs?
We see a lot of when I said about disc, and then we see as an adjunct to maybe other orthopedic problems. We see a lot that have especially spinal arthritis here, where the openings where the nerves come out, if they get narrowed, then oftentimes they'll have me.
So an alternative for a dog having difficulty with the hindquarters and things like that
is to try chiropractic, because our arsenal, the veterinary arsenal, is medications, and then we add some of these other things as compared to before, where it might just include medications. So we have this. What we notice with Honey Bun, again, like I said, is that she has a little bit of problems in the back end. When she gets that problem with the back end, we notice she starts using the front a little bit more, and she actually curves out a little bit, because that helps her get up and down. So that's why I also go top to bottom with her. So let me demonstrate.
Yes, please.
So
while you're doing that, I can ask you another question?
Sure.
We talked before, unlike just you doing this in your office in Meadville.
Right.
You have talked, I believe, whenever you did a program on a seminar out at the dog park, you talked about the fact that you work very closely with the veterinarian.
Right.
And that you, explain that to me. I remember you were saying something about the importance of you with a vet, and the vet being in on all the treatment and kind of supervising what you do. Am I right on that, or
Correct.
was I getting that confused?
No, you're right, and that's. And I'm just about done with what we call first pass with that.
So you did one pass?
I did one pass. And what we do, I start at the very top, the very first vertebra. It has two big wings on it, which I have right on my thumb. And there's that. And then the other side. She usually loves getting adjusted. She might be smiling, I don't know.
I don't know whether she's smiling or not, but she's looking pretty good to me. You're a star here, Honey Bun. You're one of the only stars in the area. Not a lot of dogs have been stars.
That's right. And what we're looking for, and it's hard to see with all her fluff, but animals give us an indication of where they actually truly needed to be adjusted. And you might be able to feel like, if you put your hand here, that you'll feel a little muscle contraction when we get the right spot. And that's tells us that vertebra was fixated, and we're freeing that up. And then I go down, and we get the sacroiliac joint, which a lot of humans have problems with, part of the pelvis right there. That's pass 2. We usually do 3. Sometimes I just do 2, depending on if the animal is very painful. Oh, you're tired.
Hey, Ben, are you going to have one more pass?
We're going to have one more pass, and then we do a procedure that stimulates that part of the nervous system I call the autonomics, which is a little different. So we're going to do one more here, sweetie. We're going to do this. We come down, we're right on the spine, because it doesn't hurt them at all. As you can see, she's not in any distress. And then we go down through. We usually, with her, we've had very little problems up top, but we start to get them right about here.
What do you think, huh? What do you think?
I know
you're a good girl. Yes, you're being such a nice girl. Yes.
And then back to the pelvis again. Yeah, she's getting you all worked up, Honey Bun. And then when we stimulate the autonomics, we just go off to the side. So I'm just going to go off to the side.
And that's just one pass of that?
Yep. I just kind of go back and forth.
All right, let's talk about how the average dog comes to you just for a chiropractic. I think we'll wait till we do a performance dog, because that's a little bit different.
Sure.
As far as how many times. But so now you're also doing her legs, or?
Yep, because remember I said she bows out a little bit. I found if I just kind of free up that joint right there, she does a little better.
Oh, good.
And then this one I just come around I just find my spot. And she's done.
There you go. And you've been a star, and you've been one of the
great.
best.
She's
Yes.
great. She usually loves to get adjusted.
Anything else we need to know about honey bun and the basic adjustment here, or
No,
can
I
we
think
move
we're-
on to
I
the
think
next
we're-
type